Hi and welcome back. In this lecture we can talk about Key Insight 7, Demographic Shifts and Dynamics of Public Health. Well, there are quite a number of trends including things like malnutrition. So fighting malnutrition, especially in developing countries, is very complex and challenging because of the limited availability of resources and funds and manpower as well. Then there's also a global food security crisis that's emerging due to a variety of factors including things like a global recession and high inflation. Then there are conflicts and wars like the Ukraine and Russia war, which are threatening global supply chains as well. And if you look at countries like China, they are still struggling to contain COVID-19 outbreaks using strict and harsh lockdowns. So a lot of factories are closed, and also things like ports and airports are operating with minimum capacity, resulting in a huge backlog of logistics shipments. And globally, we are noticing a trend of decreasing levels of fertility with increased life expectancy. So we'll have a proportionately older population, resulting in a huge weightage on the healthcare industry because older people usually require a significant amount of resources and expertise when it comes to addressing their healthcare requirements, and also this is resulting in less number of people to drive the economy forward. So when there's less people driving the economy forward, if the entire healthcare system is supported by taxation, less taxes meaning less funding for healthcare, meaning poor deployment of resources and personnel on the ground to support the requirements of the population. Then you have other factors like migration. So wars, economic crisis, disease outbreaks like this whole COVID-19 pandemic are resulting in a lot of people migrating to developed countries to improve their quality of life. So a lot of developed countries are facing a huge inflow of refugees and also migrants, resulting in an increased demand for healthcare systems. So funding and resource allocation must also increase to support that inflow, and so many other related factors and trends that we're noticing in terms of migration. Then the life in a post-COVID-19 world, so living with the SARS-CoV-2 virus would make us reconsider what public health means, and also implementing stronger mitigation steps to prevent further pandemics and outbreaks from happening and disrupting our economy. So this whole concept of living with a virus which caused a pandemic is new to all of us because none of us existed when the last pandemic hit, the Spanish flu from 1918 to 1920. So if you look at that era, the whole society was different. They didn't have smartphones and Wi-Fi that we have, but right now we have much more better and effective tools in terms of things like contact tracing, in terms of quarantining, in terms of medical research and development and delivery. So all of us need to get together and think on how we can address these kind of pandemics in the future, and how can we have a real-time network globally where certain outbreaks, so any kind of virus or bioweapon or pathogen that has a potential to cause a pandemic, is stopped and contained within a very limited geographical area rather than getting it all around the world in a very limited time. So new methods and innovative frameworks must be built from ground up to really consider on how we can address and improve these kind of challenges, and also identifying public health measurements so that we can use that as a beacon to get a good understanding of where we are in terms of public health. Then we are also noticing understanding social determinants of health, or what we call SDOH. So understanding and analyzing the barriers for healthcare at a population level and addressing them. So really understanding what are the drawbacks, what are the loopholes, what are the bottlenecks of different public health initiatives that we have taken as a country or as a region, and even globally. So a massive coordination effort with a lot of resources and initiatives must be in place to really address population health determinants, whether this is transmission of a very transmissible virus or even things like the progression of non-communicable diseases like heart diseases, cancer, diabetes, cholesterol amongst the population. And finally, we are seeing this massive trend of a greater focus on improving the mental health and employee well-being across different industries. So decision makers like the governments all around the world and companies also will have a greater focus on improving the mental health of the population, because all of us knew that life was uncertain, but this whole pandemic really made us rethink our definition of what uncertainty is, and we actually felt it. So human beings naturally want a sense of security and comfort, and also a guarantee that they have a bright future that they can wake up to. So in uncertain times and very highly stressful times, it's very important to have supportive levels of mental health support. So things like managing stress, managing anxiety, managing uncertainty, having that level of friendship with each other, social aspects of it. So let's say someone's suicidal, having a support line where people can open up their problems to, and the management must also have the level of emotional intelligence with them to address these kind of sensitive issues very, very effectively and also very tactfully. So these are a few trends that we're seeing as far as Key Insight 7, which is demographic shifts and the dynamics of public health. I'll see you on another lecture.